Okay, let's unpack this. We've all been there, right? That moment you wake up in the morning and maybe before your eyes even fully open, you just know something isn't quite right.
Mm.
That little tickle in your throat maybe, or that cough that definitely wasn't there yesterday.
Yeah.
Today we're doing a deep dive into that, well, that completely universal experience, feeling under the weather, and what actually happens when you finally go see the doctor.
And what's truly illuminating about this, I think, is how it gives you real practical insights.
Yeah.
It's such a common human experience. Our goal here, really, is to help you get a clearer understanding of the symptoms, yes, but also the medical terms, the advice.
What it all means. Yeah.
Exactly. Not just the dictionary definition, but what it implies in a real doctor's visit. We're using a detailed dialogue between a patient, Chloe, and her doctor, so we can really peel back the layers, see how doctors diagnose and advise.
It's like getting a bit of a shortcut, maybe, to feeling more confident next time you have to talk about your health. Okay, so let's start with Chloe's morning. Sounds familiar, probably. She says she woke up with a really sore throat
Uh-huh.
and a really bad cough. Right away, she thinks, okay, I'm coming down with the flu. Now, when a patient says sore throat, just that phrase, what's the doctor thinking already, beyond just, okay, it hurts?
Well, that's a great starting point because sore is such a common word for pain, isn't it? Sore back, sore knees. But a sore throat, especially with a cough, the doctor's mind immediately goes to inflammation, potential infection, where the discomfort is located.
Right.
It's like an initial flag. Helps narrow things down. And her saying she's coming down with something,
Yeah, that phrase.
that's also really telling. It perfectly captures that feeling. The very first symptoms just starting to emerge. Your body's signaling an illness is taking hold.
Sets the scene for the investigation.
It really does.
Okay, so Chloe does the right thing. She goes to see Dr. Evans. And interestingly, as soon as she starts talking, the doctor picks up on something just from her voice. Dr. Evans says, yes, you do sound rather croaky. So how does a croaky voice fit into this puzzle? And that old saying about having a frog in your throat. What's that actually mean to a doctor?
Well, a croaky voice, that deep, rough, sort of hoarse sound, it's a pretty direct sign of irritation or inflammation right there in the vocal cords or the throat area.
Okay.
It tells the doctor straight away there's likely some swelling, maybe mucus, interfering with how the voice normally works. You hear it a lot with things like laryngitis or bad colds, or like in Chloe's situation, maybe a flu-like thing. And that frog in your throat analogy, it's perfect, isn't it? It just conveys that feeling of something blocking your voice, making it rough, an immediate clue.
And it seems she got in quickly. The dialogue mentions seeing the doctor on such short notice.
Yes, exactly. On such short notice means she managed to get an urgent appointment without much warning, like maybe calling Friday night and getting squeezed in Saturday morning, or, canceling plans last minute because you need to see someone urgently. It implies it came on quite suddenly.
Right, makes sense. So Chloe's in the exam room now, and Dr. Evans gets straight to it. She moves from what Chloe says she feels to the physical check throat, chest. This is where the medical observation really kicks in.
Precisely. And the doctor sees that Chloe's tonsils are a little swollen and red. Now, swollen just means bigger than normal, right? Like a swollen ankle if you twist it.
Yeah.
But for tonsils, that's a really critical sign of inflammation, often because of an infection. Your tonsils, they're these bits of tissue at the back of your throat.
Right, I know the ones.
And when they swell up, they can be incredibly painful. Often brings on a fever, too. So that tells the doctor about the type and maybe the severity of the infection in the throat.
Okay. And Chloe also mentioned her sinuses felt blocked up. What exactly are sinuses? And then the doctor, after checking her chest, says she sounds all bunged up. What kind of picture does all bunged up paint? It sounds very descriptive.
It really is descriptive. So your sinuses are these air-filled spaces in your face, sort of around your nose and under your eyes. When they get blocked up, it's usually mucus causing pressure, pain, that congested feeling. If it happens a lot, people might get diagnosed with sinusitis.
Oh, okay.
And when Dr. Evans uses that phrase, all bunged up, it's wonderfully colloquial, isn't it? But it gives a very clear, almost visual sense of severe congestion. It means the breathing passages, nose, throat, chest, are just really clogged with mucus or phlegm. Makes breathing hard, often points to a more widespread respiratory thing going on.
So the doctor's putting these pieces together.
Exactly, translating the patient's feeling, the sounds, the visual signs into a coherent diagnostic picture.
Right. So with all this info, the croaky voice, sore throat, swollen tonsils, the bunged up feeling Dr. Evans creates a treatment plan. And it's not just one thing, it's a whole approach. There are orange pills, blue pills, cough medicine, and even an inhaler to help clear up her lungs. Let's break those down.
Yes, understanding the tools is key here. The orange pills are specified as antibiotics. Now, this is super important. Antibiotics are chemicals that specifically target and kill bacteria.
Bacteria, okay.
They work great for bacterial infections, like, say, strep throat sometimes. But, and this is critical, they do absolutely nothing against viruses.
Like the common cold or the flu, usually.
Precisely. So prescribing them depends heavily on suspecting a bacterial cause or complication. The blue pills, well, they weren't specified, but likely for managing other symptoms, maybe pain or fever. Cough medicine obviously targets the cough itself. And the inhaler, that's different again.
How does that work?
It's a device that delivers medication straight into your airways when you breathe in. It helps to open up those congested passages, making it easier to breathe. When the doctor says it will clear up her lungs, it means it helps resolve that congestion, improves her breathing function. Clear up generally means making a problem go away, clearing up lungs, a throat infection, even skin problems like acne.
Okay, so there's the medication side, but Dr. Evans also gives some really important advice for recovery that isn't just about pills.
Absolutely essential advice. She tells Chloe to stay in bed for at least 3 days. Rest is crucial. And drink plenty of fluids. This is to avoid getting weak and dehydrated. We all know dehydration means not enough water in the body.
Yeah, it feels awful.
But when you're sick, it can seriously slow down recovery. Makes you feel even more tired, makes symptoms worse.
Right.
But maybe the most critical piece of advice, thinking beyond just Chloe herself, is that she absolutely cannot go to work.
Because
Because she is highly contagious. That means her illness can spread really easily to other people.
okay, public health angle.
Exactly. The flu is a classic example. Pink eye, especially in schools, very contagious. Some things, like cancer, obviously aren't contagious at all.
So it's about stopping the spread.
Yes. And to cover the practical side, the doctor gives her a doctor's note for work. That's the official paper explaining she's sick and needs time off. It's fascinating how the doctor's approach covers everything: the meds, the rest, hydration, and the community aspect. It's holistic.
So let's wrap this up. What does this all really mean for you listening? We've kind of walked through a pretty standard doctor's visit, haven't we? From those first feelings, those symptoms you described, to what the doctor observes, and then the whole treatment plan. Understanding these terms like what sore throat signals, what swollen tonsils actually means, why being highly contagious is so important. It really can empower you. It helps you grasp what's happening in your own body, sure, but also helps you talk more effectively with doctors next time you feel, under the weather.
And that actually leads perfectly into a final thought for you to consider. Well, naturally, when we're sick, our main focus is getting better ourselves.
Of course.
Understanding when and how we might be contagious, like Chloe was, is so important. It's not just for our own healing. It's about protecting the health of everyone around us, our colleagues, our families, the wider community.
That ripple effect.
Exactly.
Yeah.
We know how fast things like pink eye can spread in a school, or common childhood illnesses like measles or chickenpox. So your understanding, even from just thinking through a simple doctor's visit like this one and the language used, it helps you make informed choices. Choices that ultimately help keep everyone a bit healthier. It's a small thing, maybe, but it adds up to better community well-being.